right into it. And what does the evidence tell you, or what are your thoughts about active rehabilitation or active approaches to rehabilitation?
So here's what the guidelines tend to say when we look at evidence-based guidelines or care pathways, ways that we should guide a patient through musculoskeletal care, which is kind of what we focus on as chiropractors. We're going to use these guidelines like the official disability guidelines, the American College of Orthopedic Environmental Medicine guidelines. Any sort of guideline is what we would encourage our practitioners to follow. And those guidelines are usually based on evidence. They're written usually by a consortium of researchers and physicians to come to some sort of agreement, like what is the best way to adjudicate any sort of patient encounter. What most of the guidelines say now, if you read a patient care guideline on something as simple as low back pain, non-specific low back pain, would be that some sort of passive care in the beginning of care is appropriate, but you definitely want to move people to active care as soon as you possibly can. And active care is where most of the recovery, most of the rehabilitation, and most of the getting the person back on their feet again is going to come from. So active care is absolutely most important.
Okay. And so all of would you say that the bulk, I'm assuming all of your care is based on this scientific approach or on that sort of that evidence-based approach to, I guess, whatever musculoskeletal problem, but in this particular,
Sure.
talking about we'll talk about mechanical back pain.
Sure. Now remember, when Sackett defined evidence-based care, he defined it as the best evidence to guide us, as well as patient expectations and clinical experience of the practitioners. So we have to balance all those equally. Now, where chiropractors err in that triumvium that needs to be balanced out, is they kind of put their own personal preferences and biases ahead of the evidence or patient expectations. So sometimes you're going to have a patient walk into a clinic, because remember, chiropractors are first contact practitioners, right? Like people come off the street and see them. So you have to bridge the gap between their expectations, what they think they want or what they think they need, and then lead them to what they actually need. So there are definitely, a wide share of chiropractic patients that come in and say, I heard you help. I heard you do the back cracking. I need some of that to fix my back. And you go, okay, well, that is your patient expectation, but now we're going to need to bridge the gap towards an evidence reality, which is that yes, some passive care is probably going to help you feel confident. It's going to help you feel like you can move your body better. It's going to reduce some of the pain temporarily so you can move a little bit better. But now we need to get into what the evidence really says, which is a positive experience with movement and learning how to take care of yourself and learning how to build your own resilience through exercise and probably some resistance training as well, which so many people are lacking.
Right. Now, and you just talked there sort of about this this amalgamation of the science and the evidence, and then your own clinical sort of, expertise, touch, whatever you want to call it. If you were to look at the mixture or the proportions of each of those things, how much would you think it is, your total care is of each, and does that vary from clinician to clinician?
Hey, Doc, it does. No, it totally varies from clinician to clinician, because we're all different in the way we believe and the way we approach. We understand this research when they looked at obstetricians and their advice to their patients, whether the obstetrician was male or female, and the kind of advice they were giving to their patients was completely different based on their beliefs and their religious beliefs and all kinds of different belief systems of the practitioner. So, when you deal with the public, you're dealing with different cultures, different races, different genders, different belief systems, and you have to bridge those gaps as much as you can. But then again, there are some doctors who don't bridge those gaps at all, and that would be under the patient expectation. We're all talking in a best case scenario, in an ideological world, we're saying all three of those, patient expectation, clinical experience, and evidence, would be equal. 33%, 33%, 33%, but they're just not. You're going to get some practitioners that are really, really hardwired, ideological, evidence driven people, and they're going to really, really, really lean heavily on the evidence. So that's on one side of the spectrum. And then on the other side of the spectrum, you have people, you know, you have chiropractors, and not just chiropractors, of course, other professionals. They're, you know, they're lighting the incense and burning the sage and doing a dance around the patients. I mean, those are the sides of the spectrum, and we just hope that the standards of deviation towards the middle aren't too far away, and that we're trying to practice the best we can in a systematized, organized fashion. And that is one of the biggest drawbacks of chiropractic, and it could be one of its strengths as well if it was used properly. Is one of the drawbacks is you don't really know what kind of chiropractor you're going to get until you walk into the office.
Right.
That can also be a positive in that they can, if the chiropractors were focused on a way of making sure that they made the proper referrals and that everybody was assessed properly and screened for red flags, it could be a way to really engender people who are not into, like, there's some cultural people and there's some people just have a belief they're anti-doctor, you know what I mean? I'm sure you've encountered plenty of people that are anti-physician.
Yes.
But if they met a really good chiropractor and they were led to understand that physicians aren't to be mistrusted, they have the best interest in mind, and they work in the best ways possible, then we can get people to the right care. So it's a double-edged sword, but one of the biggest problems right now that we encounter as chiropractors is you don't know what you're going to get. Are you going to get a good one, or are you going to get one that's going to throw like a sales pitch at you and just try to get you onto some passive care for as long as they possibly can?